connect the content together to compare the same and the difference in them. Of course, in the memory, you should not necessary to remember all, but the keyword you must understand. Of course, you can use the figures and the table to some conclusion to help you to know the content. I think this is better than the word, than the backward. Okay, now let's see the textbook, the electronic textbook. It have some chapter, have some section. And the first one, we want to see the first section, the section 1. Section 1 is the general pharmacology principles. In here, I will not introduce the detailed drugs to you, but for some common character of all the the drugs. So let's see, it has some part like the introduction and pharmacokinetics and pharmacodynamics, and the last one is pharmacotherapies. I want to see it. Oh, okay. Now let's see the let's see it. First one, the introduction. And in this chapter, see here, you should familiar with the definition. Some very important definition like the pharmacology, drug, pharmacokinetics, pharmacodynamics, and chemotherapy. Yeah, this is very easy content. In this chapter, you just only to understand and remember several definitions. That's enough. And also, you should understand the route of drug administration and know how to treat it. Now let's see. First one and the first definition. What is a drug? Okay, the first definition, drug. Let's see it. Its Latin letters is drugging. Yeah, this is just it means the dried herb. So you should understand. In first use, maybe the people wanted to use drug, and what's the resource? We know. Maybe the first source is the herb, the plant. So use it to the drug. The Chinese name is 药物. I can't see you information. Okay, no matter. So let's see the definition. Drug, its naturality is a chemical entity. Yeah, and have some activity. And the drug can be used for diagnosis, prevention, and treatment of a disease. So the keyword, let's see, the keyword is what? First one, this is the substance, the active chemical entity, and present in a dimension. And next one is use, diagnosis, prevention, and treatment of a disease. Okay, this is for this, I think 4 keywords to the definition. This is drug. Once again, a drug is a single active chemical entity maybe active substance present in a disease medicine that is used for diagnosis, prevention, treatment a disease. This is the drug. Okay, let's see the source. In a very long time, the drug maybe will come from a plant. I think this is the most the source. And most drug is come from the plants. And next source is animals. And the next one is mineral. Yeah, like the opium, the calcium, and the sulfate. This is also a source of the drug. And next one, let's see how to name a drug. It has three types. One is chemical name. I think this is a very long name because it will be named from its chemical structure. And one drug have only one name, one chemical name. And next one is a non-property name. It's also I think one name for one drug, but sometimes one drug have several the non-proprietary name. And our people have usually called them, maybe use one, maybe other people use another name, but it's very common. And in this textbook, we only use one name to the one name to one drug. Use just one non-proprietary names. And the last one is proprietary name. It's a brand name. It means maybe just one drug can be produced by different factory, different corporations. So this factory will use their own name to describe the drug. So maybe one drug have several brand names. Okay, this is the first definition. And here, can you hear me? And do you have any doubt about the definition of a drug? You can send a message, and I want to see. Can you see that? Yeah, do you have any doubt about the definition of drug? You can send a message, and I want to see where it's. If you have no doubt, I will do next one. Okay, very good. Now let's see the next. And when we want to talk about okay, and I think you will study some the physiology and some pathology. You understand about the definition disease. I think because our people will live in the world, and between around us have other active other lives. So we need to set a balance between us, like some microbes, like some other animals, like this one. But in some time, some stimulants will well, took some very maybe in short to us, and make other body, the balance in our body is imbalance. So we can feel some symptoms that abnormal. I think this is disease. This means, I think, this is just my think. The disease is about the imbalance of physiologic function. Yeah, imbalance of some physiologic function, like our prayer, the blood pressure. It will between the normal region, and if we are lower than that, we call them hypotension. But if past that, we call them hypertension. Both of these two uh, status is disease, are disease. Is right? So when some imbalance, our body also have some function adjust that to back to the balance. Yeah, back to some normal function. But if just rely on our body's function, it cannot back to the balance. We can use what? Yeah, we can use some drug. You can some drug to help us to back to the balance. So I think the drug just help us, So we have the next definition. What means pharmacology? Pharmacology. First, let's see the pharmacology. The pharmacology's the definition. Okay, you can see here. Pharmacology, it have two parts. One is pharma, pharmac, and another one is college. Pharma means what? Means drugs, and college means the science. So when we connect it, pharmacology is the science of drugs. Now let's see the definition. The science that deal with interaction of drug with the living system, the bodies. So here you should understand the definition very clearly. It has three keywords. First one is interaction. Yeah, interaction means what? Means the direction is have some bi-direction from body to the drug, and also from the drug to the body. So we call this interaction. Another one, it have two objectives. One is the drug. The exogenously administered chemical molecules. Yeah, from outside. This is exogenous. The drug is exogenous, not the endogenous. Endogenous maybe like some enzyme and some transmitter. This is produced by our body. This is not drug, and drug must be the exogenous. Another objective is our body, the living systems. Drug will help our body from the imbalance to the balance function, and also our body will do some action to this exogenous substance, the drugs, to do some action on it. So this interaction we called what? We called the pharmacology. Okay, the Chinese name is 药理学. Okay, you can listen my voice to see the pronunciation. 药理学. Okay, Very good. Now, here, do you have some doubt about the definition of 药理学, the pharmacology? No doubt or have some doubt? Okay, very good. No doubt. Let's see next one. Next one is the two aspects of pharmacology. And I have said to you, because pharmacology is a study on the interaction of drug and body, the interaction. So it also have two branches. The one branch is a sense that study how of a drug to the bodies, and another aspect, another branch, is study on the science of that the drug on bodies. So it also have two science that from the pharmacology. Okay, let's see. First one, pharmacodynamics. Pharmacodynamics. Okay. In the Chinese name, it's 药效动力学, 药效学. It will study. This is a science that study about how to the drug act on bodies. Yeah, what drug that act on bodies. We call it pharmacodynamics and short for PD. And the next science is pharmacokinetics. It's study on sense. It's a sense that study about the what the body kinetics, pharmacokinetics. So in here you understand the pharmacology have two branches. One is pharmacodynamics, the PD, 药物效应动力学, 药效学. And the next aspect is sense to study about the drug on the bodies. The bodies act on the drugs. Pharmacokinetics. And the Chinese name is 药物代谢动力学, 药动学, and can short for PK. Yeah, short for PK. So when we talk about the pharmacology, this is the interaction of drug and the body. It have include two aspects, two branches. One is PD process, and one is PK process. So let's remember the detailed definition. You can see here, pharmacodynamics. Yeah, all this content will in your textbook. If you don't understand, I can set the slide to you after class, and you also can see the textbook to understand all the words. Okay, let's see it. Pharmacodynamics. It means, the definition is what the drug does to the body, and the content of PD will include two aspects. One is action. Yeah, one is about the action, means the effect. Yeah, so when you study the PD process, you can understand what's the effect of drug on our bodies. Maybe will lower your blood pressure, will lower your temperature, will decrease your secretion, like this one. This is action. And a total action will have, if this have some therapeutic action, we call them use, the clinical use. If this action is not used, but will produce other unwelled aspect, we call what? We call them adverse effect. Okay, this is the first aspect. Next one is next content include in the PD process is mechanism. So you also need to understand why the drug can do this action on our bodies. If you solve the problem, you will answer the question. This is mechanism. And when we talk about a mechanism refers to a drug, we usually wanted to solve one problem is what's the first target of this drug on our bodies. When drugs reach to the target tissues and will do some action, and what's the first target? So this is mechanism. Okay, next one, PK process, pharmacokinetics. Because the kinetics means the movement, so this definition will refer to the next description. Pharmacokinetics means what the body does to the drugs. It will also have two major content. One is about the movement of drug in the body. Next one is the alteration of drug by our bodies. You can understand that because the exogenous drug will come into our body and maybe will flow around the secretion, and finally to get to the target tissues, the tissue that have the tissue maybe it have some disease. After that, it will do the action. So when we study the whole process of drug in our body, we call the science is pharmacokinetics. Okay, this is about the detailed definition of pharmacodynamic, and later maybe we'll ask you and sort for the PD process. Another one is pharmacokinetics and sort for the PK process. Here, you need to remember and understand about the definition very well about it. Okay, here, do you have some question about the PD process and the PK process, about its definition? Do you have some question? Okay, very good. I think you are so clever to understand it. Next one, maybe I will give you some examples. The process belongs to the PK process or maybe belongs to the PD process. You can do some exercise. And here the figures will show you about the connection between PD process and the PK process. Let's see it. When a drug, the drug is exogenous, into our body, maybe from some site of administration, while coming to our body, we call this process is absorption. After that, drug will enter into the secretion. Yeah, very good. And follow to the blood, it will float into the tissues. We call the process is distribution. And then maybe it will get to the target tissue. Yeah, some tissue have disease, and that in the site, the drug will act on the target. So in here, the drug, this science is what? Is PD. And after that, after the effect of drug, the drug will be eliminated, and our body will do some action on the drug, like some metabolism. Yeah, to change its drugs, to change the chemicals, its structures, and to disappear, to animate the action. And then the metabolite of drug will out of our body, and this process is accretion. You can see. So the movement and the alteration of drug, it belongs to what process? The PK process. So PK process will have four steps: absorption, distribution, metabolism, and accretion. When we describe these four steps, this belongs to the content of PK process. But when the drug gets to the target tissue that have some disease and do its action, this content belongs to the process of PD, the PD process. So you can see the connection. It means our body takes the drug to the target, and the drug will do some action on our bodies. So this is a connection. You can see connection. Okay, this is the effect that we need, the therapeutic action. But if the drug enter into other tissues that not have disease and also produce some action that we no need necessary, and the action produced by the drug on other tissue, we call what? The action is adverse effect. So, okay, this I think this is very clearly about the connection. So let's do some practice to understand the two definitions. One is PK and one is PT. Okay, see this single choice. What content belongs to PD process? You can see here refers to one drug, atropine. You can see the A, B, C, D choice. Which one is correct? Which one is correct? Give me your answer to see, do you understand about these two definitions? Let me see your thinking. Okay, most of you, I think most of you, except some others, have a different opinion. But I think, okay, I give you correct answer. C is correct. Atropine can be used in bradycardia. This content belongs PD. And others, you can see absorption, distribution, metabolism. This will belongs to PK process because these steps is a process of drug into the bodies and follow followed some secretion maybe like the absorption, distribution, and the metabolism. And I think some students think metabolism that is belongs to PD or PK. I tell you PK process because metabolism that's a body, that's the action of body act on the drugs to change the structure of drugs. So this no doubt belongs to the PK process. PK process. Okay, yeah, and the students that choose the D choice, do you have any doubt? If no doubt, we have a rest for 10 minutes, okay? Do you have any doubt? Okay, come back. Let's begin. Let's continue. Come back. Okay, the first class, first one we have four definition: the drug, the pharmacology, and the pharmacodynamics and the pharmacokinetics. And let's go on. Next one. The next definition is pharmacotherapeutics. Pharmacotherapeutics. It means application of pharmacology information together with knowledge of disease for its prevention and mitigation or cure. And short form, maybe just you can use your own words. Is what means is pharmacotherapeutics is use a drug, use a medicine to cure the disease that we call the pharmacotherapeutics. Next one is clinical pharmacology. It's also a branch of pharmacology, especially on the man. Yes, the objective is the man. We study the effect of drugs on man. We call what? We call the clinical pharmacology. Pharmacology. And in this one, we wanted to study some sense, some knowledge about how to use the drugs, very very good, how to do it. So optimize the use. Okay, next one is chemotherapy. Chemotherapy. It's where contest for the chemo and the therapy. Now let's first see the definition. Let's see the definition. It means the treatment of systemic infection or malignancy with specific drug that have selective toxicity for the infecting or organism or malignant cells with no effect or minimal effect on the host. Yeah, I think this is very low. The sentence is very low. Let's sort for it. What means can? Hmm? Wait a moment. Can you hear my voice? Can you hear my voice? Okay, very good, very good. Okay, once again, I want to explain the definition of chemotherapy once again. Chemotherapy means the treatment of infection or malignancy with specific drug. I think that is enough. Yeah, just a treatment to treat what it is, very specific. Two kind of disease. One is infection, another one is malignancy. Okay, when we treat these two diseases with drug, we call what? We call chemotherapy. Chemotherapy. And here, the drug have some advantage. It have very specific, very selective action just on the infection, just on the malignancy, but have no toxic action on our body, on the host cells. So this is the advantage of the chemotherapeutic drugs. Now, do you have any doubt about chemotherapy? The treatment of infection or malignancy with a specific drug, with a chemotherapeutic drug, we call it chemotherapy. No doubt? Okay. Next one, toxicology. Toxicology. is a science that study of the poisonous effect of drug and other chemicals. So this is toxicology. And when we study it, the difference between the pharmacology and toxicology maybe is major in the dose. The dose. When we use some therapeutic dose, it will produce therapeutic effect and produce a pharmacodynamics. But when we use a high dose, a very maybe toxic dose, it will produce the toxicity. This is the major difference. But the mechanism is also different. Okay, this is some definition. Next, let's see some history of pharmacology. And in modern pharmacology, not in the ancient. In ancient, the pharmacology will include in the medicine. You know that because the doctor, when we will treat the disease, not only use some surgery methods, but also use the pharmacology methods. And major maybe is the pharmacology methods. So that's not separate. But in the modern time, when some people study on the science of drug, yeah, they will make the modern pharmacology. Okay, like these people, the Viper will do some animal experiment. And still, till now, our pharmacology, the knowledge of our pharmacology is based on the results of experiments, animal experiments or the people experiments, maybe people action. Okay, so this will confirm the result and confirm the theory. And Rodolph, he will set the first pharmacology experiment room. Yeah, and in this room they do some experiment, and its student is Oswald will use the experiment method to confirm the theory and to make the pharmacology move along and along like this one. And in our China, I will introduce one people is Li Shizhen. Yes, Shizhen Li. It's in the Ming Dynasty, and he wrote a very famous book. Its Chinese name is 本草纲目. Yeah, very famous, and have many drugs from the plants, from the animals, and from the mineral to introduce how to use them, how to identify them, like this. So I think this is a pride of the pharmacist in our China, Li Shizhen. Okay, this is some introduction. And later, the people, when we to use the method of experiment to confirm the result, and they find some new concept and new knowledge, and use some theory to introduce the mechanism of drug, like the receptor. So our pharmacology will develop. Yeah, you can see this is the very famous scientist in the pharmacology. Okay, next one.